Hello everyone, today I am going to discuss another topic of pharmacology from the section antimicrobial agent, and it is a aminoglycoside. So as the name says, it's a aminoglycosides. So this glycoside, it is linked with the amino sugar, and along with this there are OH group. So this group of drug, they are highly polar, so they are not water soluble, and majority of them we are giving it by parenteral route, either by IM or IV route, and they are available as a natural and a semi-synthetic derivative, effective against mainly gram negative bacilli, and that too aerobic, not effective against the anaerobe. So they are available as a against natural as a semi-synthetic derivative. So you can see the natural, we have a streptomycin, we have a kanamycin, gentamicin, tobramycin, cysomycin, neomycin, phragmycetin and paramomycin. And under the semi-synthetic derivative we have amikacin, netilmycin and a newer one, arbicacin. So this one is got the FDA approval in 2017, May 2017. This drug, it has got the FDA approval in our country. So already I have told they are mainly polars. We give it by parenteral route. So another way of classifying this is, so these are majority of them we are giving by parenteral route or systemic use हम करते हैं इसका, and only two of them which we give by oral route, that is neomycin and paramomycin. This is used for the gut sterilization and for the GIT infection, and these we use for the topical, especially for the eye, and mainly it is for the skin where the burns are there. Neomycin, phragmycetin or infected bone, phragmycetin, gentamicin. Whereas for systemic use we have streptomycin, kanamycin, tobramycin, gentamicin, amikacin, netilmycin and cysomycin. Now you can see here like few in all the aminoglycosides I have made given a red color to Y and I. So few of aminoglycoside were in a spelling mycin. Mycin में Y है, and few they have a mycin में it is a I. ठीक है? Here it is I and here it is Y. So what is the significance of this? Where the Y is there, they are derived from streptomyces. That is called mycin. And the compound which are derived from micromonospora, they are called mycin. So this is very important YOC question. So they ask why it is Y. What is the significance of this Y and I? Now next is how this group of drug they act. Aminoglycoside, they are bactericidal. They act by inhibiting the bacterial protein synthesis. Now important is now how the bacterial protein that is synthesized and which step it is going to inhibit. So bacterial protein, it is for the synthesis of the bacterial protein we need RNA. Okay? All the three type of RNA we need: transfer RNA, messenger RNA and ribosomal RNA, and all these they come from DNA by RNA polymerase. Now these three, they form a initiation complex. Okay? Now RNA, what they have? They come from the transcription. So DNA, the message of the DNA, that is transcribed in the form of, they are transcribed in the form of messenger RNA, not the ribosomal RNA. So it is a messenger RNA. So messenger RNA, they have a copy of DNA. Now how the initiation, that is how they are going to initiate the protein synthesis by forming a complex. So this is where you can see all the RNA. This is a messenger RNA. This is the 30S subunit of ribosomal RNA, and this is a transfer RNA. And this transfer RNA, it carry the amino acids, whatever the previous amino acid. Suppose the 2 amino acid, they are there, A, B, or 1 and 2 amino acid, they are already attached here. So this is how initiation complex that is formed. And on this, the third one is a even 50S ribosomes, that will be also come here. Okay, so this is a 30S and this is a 50S. So together it is a 70S. Okay, the 70S RNA, ribosomal RNA will be there. Now these 50 and 30S, they have two important sites. And what are the important sites? It is A site and it is a P site. P site is peptidyl site. Peptidyl site is which is having already a peptide chain. जिसमें पहले से ही आपका peptide chain it is already there. The previously attached peptide chain that is already attached here, like 1 and 2. And A site which is ready to accept the next amino acid. Now which amino acid it is going to accept, and which is going to transfer that amino acid. So transfer of the amino acid, that is with the help of transfer RNA. Now transfer RNA, it is going to transfer which amino acid over here, that depends on the code, this code. So second code is, it is CCG. Now transfer RNA, it is going to recognize this code, and which transfer RNA it is going to this one, the transfer RNA which is having the anticodon just G, G, C, and this is going to transfer another amino acid. Suppose it is amino acid 3. So it is going to transfer, depending on the code, the transfer, that particular transfer RNA will be attached here. Okay. Now what is the next step? Next step is this whole thing, this one, this, the previously attached amino acid will be shifted to the newly attached amino acid. So this newly attached amino acid, it is going to form a peptide bond with the previously attached the or previous chain of the previous polypeptide chain. मतलब ये नहीं कि यहाँ से कि एक ही जाएगा दो. This 1 and 2 both will be transferred from here to here. Okay. So I'll show you in the next. And how it will be, this whole thing will be like here it is 1, 2, this, and new peptide bond that is formed. It is removed from here and it will be shifted to this side. Now what will happen, this I'll just complete this one. Now this ribosomes, this whole subunit 30S, they are going to move along. ये इसके ऊपर on this messenger RNA one step कहाँ से, यहाँ से, from this codon it is going to move to this codon. This whole subunit, this 30S and 50S, they are going to move on the messenger RNA. How much distance it is going to cover? It is going to cover a distance of 1 codon. Or another way we will say the whole thing, this will be shifted, translocated from here to here. Meanwhile, this whole thing, what will happen, this whole thing will be shifted, 3, 2, 1, it will be shifted from here to here. ठीक है, ये यहाँ से यहाँ शिफ्ट कर जाएगा. Then again you can see in the next diagram, again it will be ready, this acceptor site, it will be ready to accept the next. और ये वाला सारा, this is again ready for the next this thing. ठीक है, तो ये यहाँ पे आ जाएगा. acceptor site will be here, it will be here, acceptor site, and P site will be here. ठीक है, and this will move to the E site or it will be exit. ये जो this transfer RNA, it will be removed. Now again this A site, it is ready to accept the next this thing, amino acid, depending on the codon which is present on the messenger RNA, and this way a long peptide chain, polypeptide chain, it is formed. This is how the bacteria, they are going to synthesize the protein. So what are the steps? Initially, there will be initiation complex that is formed, where all the RNA, messenger RNA, ribosomal RNA and transfer RNA on which the previous peptide chain that is attached, all they come together. Then number 2, there will be attachment of or transfer RNA, it is going to bind with the site. Transfer RNA क्या करेगी आपकी, bind करेगी. There will be attachment of the transfer RNA. Transfer RNA attachment to acceptor site. So depending on the codon which is present on the messenger RNA, it is going to transfer the amino acid. Then peptide bond formation. Third one is peptide bond formation between the newly attached amino acid and the previously between the peptide bond formation between newly attached amino acid, जैसे यहाँ पे ये third लगा, and the previously polypeptide chain. Then the fourth step is the whole thing, it is shifted from the acceptor site to the peptidile. That is a translocation. Translocation of the this whole polypeptide chain from A site to P site, and this is again free. A site is again ready to accept the next transfer RNA. So these are the steps of the protein synthesis. So there is a initiation complex. Now different antimicrobial agent, they act at different sites. So you can remember it as a like A, B, C, D and E. Okay? You remember it this way, A, B, C, D, E. So A is for the aminoglycoside. उसके बाद ये B वाला छोड़ दो. C, वहाँ पे peptide bond formation, that is a chloramphenicol. And then again remove the D. So B and D एक छोड़ के, this one is a for the erythromycin. So A, C, E, B and D, you just remove it. And ये वाला step आपका रह गया. Now this one. Now which drug? It starts with the T. So you write it here, tetracycline. So these drugs, they act by inhibiting the bacterial protein synthesis. A for the aminoglycosides, T tetracycline, C chloramphenicol, and E is a erythromycin. Now aminoglycoside, it is going to inhibit the initiation complex, or the book it writes the word, it frees the initiation. It binds to the 30S, especially the streptomycin. It binds the 30S subunit or 50S, and they say even at the interphase also. This is a one way how the aminoglycoside it is going to act. Now what else it does, aminoglycoside, apart from this? it causes the misreading of this messenger RNA. Aminoglycoside, it causes the misreading of the messenger RNA. What is that? Misreading of the messenger RNA. Now, this transfer RNA, it is going to transfer, ये जो आपका transfer RNA, it is going to transfer the amino acid on the basis of what? It is going to transfer the amino acid on the basis of this codon. Suppose here codon is CCG. Now what happens? This transfer RNA, it is going to read, misreading means CCG ki jagah. Suppose instead of reading it as a CCG, it is going to read it as a GGC or GCG. मतलब instead of reading it as a CCG, it is going to read it. मतलब वो transfer RNA को ये लगता है कि instead of this codon, it is this. So depending on this, it is going to transfer the amino acid. So this is called the misreading. So aminoglycoside, it acts by freezing the initiation. Second one is it causes a misreading of the codon. So by misreading, now what will happen? The faulty amino acid will be transferred. What will happen? एक तो ये आपका हो गया. Second one is there will be faulty amino acid will be attached and wrong protein will be synthesized. Because of that wrong, it is going to do what? It is going to disrupt the bacterial cell membrane. And cell membrane, it becomes more permeable ions and it become leaky. Okay, it becomes more permeable and more leaky. So all the things, content of the cell, it will come out, and by this what will happen? There will be lysis of the cell. So all these, ये जितने मैंने आपको यहाँ पे बताए हैं, A, T, C, E, they act by inhibiting the bacterial protein synthesis. They are mainly what? They are mainly bacteriostatic drug, except aminoglycoside. So aminoglycoside, that is only a sided, otherwise rest of the antimicrobial agent which act by inhibiting the bacterial protein synthesis, they are bacteriostatic. Static is which is going to inhibit the multiplication of the bacteria, and bactericidal is which is going to kill the bacteria. So why? The reason is because there is a formation of the faulty protein. With the formation of the faulty attachment of the faulty protein, it is going to make a changes in the bacterial cell membrane, making it more permeable. So ions and other content of the cell come out and it causes the lysis of the cell. Now, this is how the aminoglycoside it acts. But there is one important step. What is that step? Is to, this is a figure, I have taken it from the standard textbook of the pharmacology, that is by K.D. Tripathi. You can see here also the various step of the protein synthesis. The same, it is a all the 3 RNA, messenger RNA, then the 2 subunits of the ribosomal RNA, and this is a transfer RNA. All they are together, and the same way it is 2 site, A site and a P site. Here it is a P site, previously attached amino acid, and acceptor site, it is going to accept the newly attached amino acid. So the first drug, it is here, this is a aminoglycoside A. Second one is a tetracycline. C is a C, and D ko chhod ke E is erythromycin. So this you will be reading, seeing in the book, and below that this figure it is given in the chapter tetracycline. You can see this figure, tetracycline and chloramphenicol, वहाँ पे दिया हुआ है, and in that figure उसके जो नीचे notes होते हैं figure के, so you will be seeing all that content, what exactly which drug it is going to, or which antimicrobial agent it is going to inhibit the which step. Now, this aminoglycoside, it acts by inhibiting the bacterial protein synthesis, and the most important is to inhibit the bacterial protein synthesis, drug has to enter within the cell. So, transportation of the drug from the outside to the inside. Now, it is effective against which bacteria? This drug, it is effective against the gram-negative bacteria. So, a simple structure of gram-negative bacteria I am just drawing here. So, how it enters within the cell? So, initially it has to cross the cell wall and the plasma membrane. So, this is a cell wall of the gram-negative bacteria. Here you will be seeing various poring channels. So, initially the aminoglycoside, it is going to cross this cell wall through the poring channel. So, there is a passive diffusion through poring channel. Okay? This is poring channel. Then from this periplasmic space across this cytoplasmic membrane, how it is going to enter. So, this is by the carrier mediated transport, and it is dependent upon many other things. What are those? I'll simplify it. It is oxygen dependent and also pH. The alkaline pH, it favors its penetration. So, these are the two things. So, oxygen dependent, if it is oxygen dependent, then what will happen? This aminoglycoside, it is effective against the aerobic gram-negative aerobic microorganism, not effective against the anaerobes where oxygen that is absent. So, this is how it is going to enter. So, penetration of this aminoglycoside through the cell wall, that is passive, diffusion through the poring channel, and from the periplasmic to this across the cytoplasmic membrane, it is a carrier mediated, which is dependent upon the oxygen and a pH. Alkaline pH, it favors the penetration of the aminoglycoside from the periplasmic space across the cytoplasm. And how the bacteria, they develop resistance to this aminoglycoside. Number one is this poring channel. The aminoglycoside, they are not able to cross this poring channel. So, penetration. So, transport defect. Number one, this. Number two, it acts by binding. एक बार अगर cell के अंदर है तो it is going to bind with what? It is going to bind with the ribosomes. So, alteration in the ribosomal binding site. That is the number two. And the most important is, now what will happen? The cell membrane. Okay? The cell membrane, they are going to acquire the enzyme. And how they are going to acquire the enzyme? This is synthesized by the, or they are going to acquire the enzyme because bacteria, they acquire the enzyme by mutation, by conjugation. Okay? Mainly by the conjugation, they are going to acquire this bacteria, it acquire the enzyme. And once it acquire the enzyme, now what will happen? That enzyme is going to make a changes in the aminoglycoside. Now what will happen to this aminoglycosides? They are going to cause even this aminoglycoside get phosphorylate, acetylate or adenylate. Now once these enzymes, they bind with the aminoglycoside, then what will happen? This aminoglycoside, after binding with this, it won't be able to bind here. ये ribosomes के साथ bind नहीं करेगी. So this is the most important, how this aminoglycoside, it develop the resistance. So how the aminoglycoside, it act, the two steps, one is the transport, एक आपका ये transport हो गया. Number one is the transport across the membrane, and number two is by inhibiting the bacterial protein synthesis and how it is going to develop the resistance. Now, another important is now, next one is its antimicrobial spectrum. The aminoglycoside, its antimicrobial spectrum. So in my previous video on the macrolide, there also I made a same kind of slide. If you haven't watched that video, please go and watch that, how you can memorize this antimicrobial spectrum. Because in the book, if you are reading Tripathi, or if you are reading Sharma or any other book, you will be reading all these microorganisms all together. Strepto, Staphylo, and in a series you will be reading like this, and it is easy to read and more easier to forget. And in the exam, mostly the students, they get the question, what kind of question they are going to get. They get the question classification. You are supposed to write the classification of aminoglycosides or macrolide, which already I have made a video, and then classification of aminoglycoside, write its mechanism of action, ये आता है, its therapeutic uses and adverse effect. ऐसे आता क्वेश्चन आपको. Classification, write its mechanism of action, therapeutic uses and adverse effect. And where you are supposed to write the antimicrobial spectrum whenever you are going to get a note. आपको कोई individual drug पे आ जाता है, ठीक है. Suppose you get a note on amikacin, then you are supposed to write the antimicrobial spectrum, ठीक है. Now, is it because we are getting such type of question, you don't have to read or memorize the antimicrobial spectrum? No, because you are supposed to write the therapeutic uses. आपको ये therapeutic uses लिखने हैं, because you are supposed to write the therapeutic uses. So therapeutic uses आप कैसे लिखोगे? If you remember, अगर आपको ये वाले सारे पता है कि हाँ ये किस किस के against है, it is effective against what microorganism, ये किसके against है, then you can write like in this slide how I have made this one. So first you write all the positive cocci like Staphylo, Strepto in a piece of paper, Staphylo, Strepto, Pneumo, then gram-negative cocci, positive bacilli, negative bacilli, and the various miscellaneous. Mycobacteria लिख लो आप सारे, and the various miscellaneous जितने भी आपको याद आते हैं, ठीक है. And especially related with that particular antimicrobial agent, try to write accordingly. So here what you are seeing, you will be seeing it is only in the central section, majority of the, and then what you do, this particular antimicrobial agent, it is effective against which microorganism. पॉजिटिव के लिए है, नेगेटिव के लिए है, पॉजिटिव कोकाई है कि नेगेटिव कोकाई है, पॉजिटिव बेसिलाई है कि नेगेटिव बेसिलाई है. यू जस्ट पुट अ प्लस साइन, प्लस या क्रॉस, जो भी whatever you find it convenient. If it is a highly sensitive, use 3+. If it is a moderately sensitive, use 2+. And if it is a mildly, then use only 1+. And if it is not showing any activity, then you just leave that place. ठीक है, आप वो वाली जगह you just leave that place. So उसको आप छोड़ दो, ठीक है. And here you can see all the central section. It's negative bacilli. Negative bacilli में भी what you are saying, E. coli, Klebsiella. Then here you see the क्रॉस किया मैंने, स्पेशली साल्मोनेला, ठीक है, इसीलिए मैंने उसको बड़ा फोकस किया. इट इज इफेक्टिव मेनली अगेंस्ट, सबसे पहले मैंने बता दिया, मेनली अगेंस्ट द ग्राम नेगेटिव बैसिलाई. विच वन? एरोबिक. एनारोब्स के लिए नहीं है. तो ग्राम नेगेटिव में भी it is effective against almost all the Enterobacteriaceae but not against the Salmonella. फिर आ गया आपका Shigella, Proteus. Proteus भी यहाँ पे आपका शुरू होता है. This आपका Streptomycin, Tobramycin, they are not, Kanamycin, they are not effective. But उसके बाद आपको Gentamicin and Tobramycin, they are showing the activity against the Proteus. Even for the Pseudomonas also. आप जब ये Pseudomonas देखते हैं, for the Pseudomonas also, the first one is Streptomycin is the first parenteral aminoglycoside, followed by Kanamycin, and Gentamicin is the third one. So ये पहली दो, Streptomycin and the Kanamycin, they are not showing any activity even against the Pseudomonas. Then comes Pasteurella, Yersinia pestis, and Francillella tularensis. ठीक है. This is also showing the activity streptomycin. बाकी आप देखो कहीं पे भी it is not showing any activity. Then hemophilus influenza, hemophilus ducreyi. Bordetella में it is not showing any, कुछ भी नहीं है. Erythromycin, there you can see Bordetella, it is used for the whooping cough. Then brucella यहाँ पे आपका आ जाएगा. Then Mycobacterium tuberculosis, लेप्रा में नहीं है, एटिपिकल में नहीं है. Mycoplasma यहाँ पे भी कहीं नहीं है. एंड लिस्टीरिया, लीजियोनेला, जेंटामाइसिन, कैम्पाइलोबैक्टर एंड यहाँ पे क्या है, कैलिमोमेटोबैक्टीरियम, दैट इज शोइंग द एक्टिविटी. सो इफ यू रिमेंबर दिस टेबल एंड प्लस दिस ग्राम पॉजिटिव, ये वाला एट वेरी हाई कंसंट्रेशन, ठीक है. बट एज यू मूव फॉरवर्ड, this gentamicin, it is showing the activity against the gram positive. Then the newer one, arbacacin, amikacin, they are showing arbacacin, it is showing activity even against the methicillin resistant staph aureus. So if you make such kind of table, then you can write the therapeutic uses. यहाँ पे like I will have the visual, the majority of the plus they are seen in the center. आपको जहाँ पे negative bacilli है वहाँ पे है. Now E. coli, that is a causative organism of UTI, protease, Shigella for the UTI and for the gastroenteral infection. So it is mainly used there. ठीक है, अगर आप इसको देखो. बट हेयर इफ यू सी द स्ट्रेप्टोमाइसिन का यहाँ, बट हाँ डेफिनेटली दे आर द बेटर ड्रग. आप कितना देख रहे हो, सिंगल प्लस देख रहे हो. So there are better drug like fluoroquinolones. They are also effective against the gram-negative bacilli. So they are preferred over this. तो इसको कहाँ पे हमने use करना है? This drug, it is mainly used for the Yersinia pestis, plague के लिए है. And before that, the tuberculosis. Tuberculosis में अगर आप regime पढ़ते हो, it is a second line drug for the treatment of the tuberculosis. So पहले इसको करते थे फर्स्ट लाइन में, बट इट इज नॉट यूज बिकॉज दिस इज गिवन बाय पारेंट्रोलून. सो फर्स्ट लाइन में आपकी क्या है, INH, that is H, pyrazinamide, rifampicin and ethambutol. Whereas streptomycin, it is a second line drug, and because we give it by parenteralone. So first it is for the tuberculosis, mycobacterial tuberculosis. फिर उसके बाद Yersinia pestis आपका plague आ गया. Then for the tularemia, these are the therapeutic uses of the streptomycin. अगर मैं करती हूँ उसके बाद tobramycin, then next is kanamycin. Kanamycin कहाँ पे यूज होती है आप देख लो कहीं. Kanamycin, it is a second parenteral aminoglycoside. Antibacterial spectrum is just like a streptomycin, but streptomycin, it is a least nephrotoxic, whereas kanamycin, it is a nephrotoxic potential, it is more. So this is used as a second line. वहाँ जहाँ पे we cannot put the patient on streptomycin as a reserve drug, we can use it for the tuberculosis. That's it. That's the only use of the kanamycin. Then the third one, gentamicin, the third parenteral aminoglycoside is gentamicin. Here you can see more plus. So this is used where gentamicin, it has got the wide spectrum. So in a gentamicin, this row you can see more plus, number of plus, 3 plus you will be seeing, and it is also covering the important protease and pseudomonas. So it is very commonly used along with the gram positive for the empirical therapy. जहाँ पे आपको पता ना लगे mixed infection है, you want to give antimicrobial agent against both gram positive and gram negative. तो उसमें हम क्या करते हैं, like we give it a combination with the penicillin. Penicillin के साथ आप इसको देते हैं, penicillin and gentamicin combination very commonly used along with the cephalosporin and gentamicin. So cephalosporin, they are going to take care of the gram positive microorganism, whereas gentamicin, it is going to take care of the gram नेगेटिव जहाँ पे आपको पता नहीं चल रहा. एंड मोर ओवर लाइक जहाँ पे आपका पेशेंट ऑन द वेंटिलेटर, पोस्ट ऑपरेटिव निमोनिया है पेशेंट को, ट्रेकोस्टमी वाला पेशेंट है, देयर वी कैन पुट द पेशेंट ऑन दैट. फिर ये सूडोमोनास के लिए है, प्रोटीज के लिए है. सो वी कैन गिव इट फॉर द ऑस्टियोमाइलाइटिस, फॉर द एब्सेसिस, फॉर द नॉट फॉर द एब्सेसिस, फॉर द बर्न पेशेंट, देयर वी कैन यूज दिस वन. ठीक है. Then whereas this is not showing any effectivity against the किसके अगेंस्ट द माइकोबैक्टीरिया ट्यूबरक्लोसिस. सो ट्यूबरक्लोसिस के लिए हमने इसको बिल्कुल यूज नहीं करना, एंड इट इज शोइंग लेस इफेक्ट अगेंस्ट द ट्यूलेरीमिया. ये, तो इसको भी यहाँ पे हमने नहीं करना. फॉर दिस वन, फॉर द मेनिंजाइटिस वी कैन गिव यहाँ आपका स्टैप और पॉजिटिव इन्फेक्शन अगर आपको रेस्पिरेटरी, उसमें भी हम दे सकते हैं पेशेंट को. देन कमिंग टू द दिस वन tobramycin. This is just like a gentamicin showing more activity against the protease and the pseudomonas. जहाँ पे gentamicin की resistance है, there we can use the tobramycin. That is the only use of this. So if you are making such type of table, it is very easy to memorize the therapeutic uses, and antimicrobial spectrum also you will remember it for a longer time. Then cyssomycin gram post beta hemolytic streptococci. It is showing effectivity against that also. Plus सूडोमोनास, ठीक है, यहाँ पे भी है इसकी. एंड देन नेटिलमाइसिन मेनली फॉर द क्लैप्शियला, सूडोमोनास. देन अमिकासिन, दिस इज ऑल्सो प्रोटीएस सूडोमोनास. नाउ अमिकासिन, it is also used even for the tuberculosis. Amikacin is for the, here also it shows activity, amikacin, for the mycobacteria tuberculosis. Amikacin, it is also has a wide spectrum. It is used where the microorganism, they are showing resistance to the gentamicin, because this is the drug. It is even if the aminoglycoside, if they are going to acquire that enzyme phosphorylate or adenylate, then also they are going to kill the bacteria. So this is how it differs from rest of the aminoglycoside. And same the last one, arbacacin. This, its status is also same, just like amikacin. It is also going to have a bactericidal status, even though it is going to attain that enzyme. So this is how it differ from the others. So it has got the wide spectrum. So arbacacin, which is got the FDA approval in 2017. So this is also effective against E. coli, then Klebsiella, Pseudomonas. Okay, so wide spectrum, and but the toxicity of this drug, it is also same. Okay, so this is various aminoglycoside and where we can use it. अगर हम मोटा मोटा देखें, it is mainly effective against aerobic gram-negative bacilli, and where we are going to use it, we are going to use it, especially the gentamicin. It has got the wide spectrum. We can use it in the empirical therapy along with the gram positive, जैसे penicillin के साथ और cephalosporin के साथ. We can give it for the, and this it is also effective against the listeria, legionella, and for the, that's why we can use it even for the respiratory infection also. So it is mainly used for the mixed infection, ठीक है. Then for the burns patient, for the ulcer patient, ठीक है, जो भी आपके हॉस्पिटल ट्रेकियोस्टमी पेशेंट, पोस्ट ऑपरेटिव निमोनिया, उसमें आप दे दो, मेनिंजाइटिस के लिए दे दो. देन फॉर द SABI, subacute bacterial endocarditis, this is another use. Whereas streptomycin mainly for the tuberculosis, plague and tularemia. Tobramycin as a kanamycin as a reserve drug, whereas the tobramycin and this cyssomycin, they are just like they are analog of, or you can say they are same like a gentamicin and netilmycin. All the three, they are the same like a gentamicin. Amikacin, it is a derivative of the tobramycin, and arbacacin, this is a neuron. So arbacacin and amikacin, they have got the wide spectrum. Then the last one is a neomycin, which we give by, कैसे देते हैं हम इसको, we give it for the guts because it is too toxic. If we are giving it by systemic route, it is too toxic to use this one systemically. Nephrotoxic, and so systemically we do not use it. It is mainly used topically. Topically जहाँ पे पेशेंट को अल्सर है, बर्न है, कोई इन्फेक्शन है, there we use it. And then for the gut sterilization. So GIT के लिए gut sterilization, what we do, we give this one. This is going to take care of the aerobic bacilli, and along with that we can put the patient metronidazole, that is going to take care of the anaerobes. So another use of this neomycin is it is also used in hepatic encephalopathy. यहाँ पे भी हम इसको यूज करते हैं. ठीक है. So What's its role in the hepatic encephalopathy? So normally, what is the function of liver in the body? If from the urea, if there is a formation of ammonia, then this ammonia, the liver is going to make this ammonia to the non-toxic product. तो कुछ भी नहीं होता. Now if the person is having a liver failure, now this function will not happen. Now what will happen to this ammonia if the body is going to make, and where the body is going to, normally तो बेटा कुछ नहीं होगा patient को, like in the gut, if the person get infected with the gram negative like protease से अगर उसको infection हो गया, ठीक है, और urease producing microorganism, protease is a urease producing microorganism, then what will happen? This is going to convert urea into ammonia. ठीक है. Now this ammonia, now it is not converted. ये अब यहाँ पे इधर से ये, this is not now liver, because there is a liver failure. So this conversion of this ammonia into the non-toxic, it is not, does not happen. Then where it will go? It will cross the blood-brain barrier and cause what? Encephalopathy. ठीक है. So in the gut, if the person get infected with the urease producing microorganism or protease, protease is a gram negative bacilli, this is going to convert urea into ammonia. Normally this ammonia, it is converted into non-toxic product by the liver, but if the person is having any liver failure, then what will happen? It is going to cross, this ammonia will cross blood-brain barrier and person will end up with the hepatic encephalopathy. Now what the neomycin it does? This neomycin, if you are going to put the patient on neomycin, it is going to kill this urease producing microorganism. Then urea will not be converted into ammonia. This is one way. But neomycin, it is also nephrotoxic and it has got the toxic potential. And second thing is, once you give it, it is going to damage the intestinal this thing, that villi, उसको भी ये damage करते हैं. So that's why we do not prefer the neomycin even for this. Then it is a toxicity is also there with this. So another drug which we can use for this purpose is, from the same group, we can also use the paromomycin. This is also, and then lactulose. Now what this lactulose they are going to do? They are the disaccharide. Once you give, it is broken up into the, ठीक है, ये इसके जो होते हैं, it is broken up in the colon, and what it is going to, once it is broken up in the colon, then it is going to make the pH of this, इसको क्या करेंगे? They are going to change the pH of this colon, acidic pH कर देंगे. Now if acidic pH is there, then what will happen? This will hamper the action of this protease, because protease it needs a pH. कौन सा pH चाहिए? Alkaline. Now as pH is acidic, so it is going to inhibit the action of this urease producing microorganism, that is protease. This is how the lactulose it is going to help in the patient with the hepatic encephalopathy. So for the hepatic encephalopathy, we have three drugs. One is we have a neomycin from this group, then we have a paromomycin, and the third one is we have a lactulose. Then important pharmacokinetic of this. This drug we give by parenteral route and it does not reach CSF, intraocular fluid, okay? And only where it is going to achieve the high concentration, that is the renal cortex and in the labyrinthine fluid, inner ear. And inflammation increase the penetration into the peritoneal and pericardial cavity. Contraindicated in the pregnancy because it is going to cause the hair loss in children. overdose अगर हो जाती we can remove it by hemodialysis and peritoneal dialysis. And half life of majority of this is 2 to 4 hours. So if half life is 2 to 4 hours, then ideally we should give this group of drug by either 3 times or 4 times. ठीक है, इसको आप यहाँ 2 या 3 अगर हम if you have a concept of general pharmacology, how we give the drug, the dosing schedule of any drug that is dependent on the half life. तो इसके हिसाब से it's we have to give it for 3 to 4 times. पर इसमें यहाँ पे करते नहीं है. The gentamicin or this aminoglycoside usually we prefer to give a single injection. हम patient को single injection देते हैं. Now what is the reason for that? Why the dosing regime of this one is this? So antimicrobial agent, they follow 2 type of killing. One is a concentration dependent killing. Another one is a time dependent killing. So concentration dependent killing, that is the ratio of the peak concentration of the antimicrobial agent over the minimum inhibitory concentration. मतलब इसकी killing depend करती है the peak concentration of the antimicrobial agent. And what are the drug which follow this concentration dependent killing? One is, which we are reading, aminoglycosides. Then we have a fluoroquinolones and a metronidazole. And at least remember these two. Fluoroquinolones we give the newer one or by OD or once a day, but the few of them we give by 2 times a day. So aminoglycoside, its killing, it depends on, it causes a concentration dependent killing, though half life is 2 to 4 hours, but because it follows the concentration dependent killing, we give it by a single dose. Now what is a time dependent killing? Time dependent killing is a ratio of length of the time at which the concentration is above the MIC to the, okay, and rest of the antimicrobial agent, their killing is a time dependent killing. So that's why we give it by 2 times a day, depending on its half life, twice a day, thrice a day, and accordingly we give the dosing reason. What are the other important pharmacokinetic feature? It get excreted through the urine. Okay, then its excretion, it parallels the creatinine clearance. So any patient with the renal insufficiency, then what will happen? Any patient if shows the renal insufficiency, then we have to reduce the dose. Depending on the creatinine clearance, we have to adjust the dose. Agar patient ki creatinine clearance, if it is 70 ml per minute, then we have to give the 70% of the dose. If it is 50 ml per minute, then 50% of the dose. If 30 ml per minute, then it is a 30%. So there are the few important pharmacokinetic parameter exercises, they are there on the basis of this. If it is a 20 ml, then we give the 80% dose, but on the alternate days. So this is how we change the dose of the, or we modify the dose depending on the creatinine clearance of this. So these are the important pharmacokinetic feature. Pharmacokinetic feature में क्या है? Its dosing regime, that is dependent on the concentration. That's why we give a single, and because it is cleared by the glomerular, सीधी की सीधी, unchanged, it gets excreted through the urine without any change. So its excretion, it parallels the creatinine clearance. So if the person is showing elderly patient है, कोई patient है जिसकी renal insufficiency, or the children whose GFR is low GFR, then low this thing, so in that cases we have to see the creatinine clearance, and accordingly we have to modify the dose of this, right? And another important is its maximum, where it is इसकी maximum किस में होती है? High concentration is achieved in the renal cortex and in the inner ear. So because of that, it shows the important toxicity. इसकी toxicity कहाँ पे है? It is nephrotoxic. ये nephrotoxic है. This is the very important question of this, from this topic. Write the important toxicity of the aminoglycoside. So it is a highly nephrotoxic. Renal cortex may have where the tubules, they are there. So if the tubules, then what will happen? The concentration ability of this is reduced. Then low GFR, there will be cast, albumin will be also lost in the urine. So this nephrotoxic potential, it is a reversible also. If you stop the dose, then what will happen? Patient will recover. So any patient with the renal insufficiency or renal injury, don't put the patient on this drug and don't combine this drug with any nephrotoxic drug. And streptomycin, that shows the least nephrotoxicity. Okay, and if any patient is having any renal insufficiency, then what will happen? If you are putting the patient on aminoglycoside, first thing is it is nephrotoxic. Second thing is it will not be cleared from the body. Then what will happen? The high concentration will be there, and that is going to enhance the autotoxicity. Okay, so one is nephrotoxicity and another one is autotoxicity. So autotoxicity is, it can cause the cochlear toxicity and it can cause the vestibular toxicity. So cochlear toxicity, that is a hearing loss. इसमें क्या होगा patient को? Hearing loss will be there. First for the high frequency sound followed by the low frequency sound. So there the deafness, that is permanent. जो आपके ऑर्गन है वो परमानेंट होगी. वेयर इज वेस्टिबुलर टॉक्सिसिटी? वेस्टिबुलर टॉक्सिसिटी में क्या है? दिस इज ऑल्सो व्हाट विल हैपन हियर, द पेशेंट विल बी हैविंग अ हेडेक. ठीक है, पेशेंट को पहले हेडेक होगा, देन देयर विल बी नोजिया, देन देयर विल बी डिजीनेस, देन इन द एंड पेशेंट विल बी हैविंग दी ataxia, and then patient will be having a dizziness and all that. So what will happen? Patient, इसमें भी the patient is going to recover. It is going to take years with the vestibular toxicity. And the next important adverse effect is neuromuscular blocking effect. So this neuromuscular blocking effect, how it is going to block this neuromuscular blocking effect? So this is, suppose, cholinergic neuron, where this synaptic vesicles, they have acetylcholine. Now how this acetylcholine, it is released? This fusion of this synaptic vesicles with this membrane, and then there is a release of this. And this fusion of synapse, if you are going to give the aminoglycoside, this fusion, it is going to block this fusion, so there will be no release of this acetylcholine. So this is how it is going to block this neuromuscular blocking effect, so they won't be able to bind further with the receptor. And this effect, it is how it is fused, because with the entry of the calcium ion. So aminoglycoside, they antagonize this action of this calcium. And normally this does not happen if you are using the aminoglycoside in the peritoneal cavity or in the pleural cavity, and you have given the patient the G-tubercularine, then you can see the apnea and other fatalities. So this is about the toxicity. Remember the important toxicity: nephrotoxicity, autotoxicity, under the autotoxicity, cochlear toxicity and vestibular, and the third one is a neuromuscular blocking effect. So in toxicity, you can see streptomycin, that is the least nephrotoxic. This is an important MCQ. Okay. Kanamycin and amikacin, they are showing the maximum cochlear toxicity. Streptomycin and gentamicin, they are showing the maximum vestibular autotoxicity. But if we take up the neomycin also, so neomycin, they show the maximum neuromuscular blockade effect. ठीक है, उसके साथ आती है आपकी, and even the nephrotoxicity is also maximum seen with the neomycin. So what are the important precautions and interaction? Avoid it during the pregnancy. Don't use it with other autotoxic drug like high-ceiling furosemide and minocycline, nephrotoxic drug like amphotericin B, vancomycin, cephalothene, cyclosporine and cisplatin, patient with the middle age and patient with the renal damage. And be cautious when you are using it with the be cautious use of muscle relaxant in a patient who are receiving the streptomycin, and do not mix it in same syringe or in a infusion bottle. So that's all about the aminoglycoside. Now look at the few important questions which you may get from this topic in the MBBS. The most important is adverse effect of the aminoglycoside, where you are supposed to write all the toxicity. Then why and कौन सी toxicity है इसकी? We have a nephrotoxic, ototoxic and neuromuscular blocking effect. Why single injection of the aminoglycoside that is more effective? Because of it shows the concentration dependent killing, and you have to explain this. Which aminoglycoside is given orally and for what? We have two. One is neomycin and another one is paromomycin. So paromomycin is like framicetine. I have left framicetine and neomycin. They are too toxic to be used systemically. So both of them, they are used topically. ठीक है, जहाँ पे burns है, ulcer है, कोई local infection है, there we use it. Whereas paromomycin, it is effective even against the इसको hepatic orally देते हैं. One I have used for the hepatic encephalopathy, वो मैंने बता दिया. I have told you about the use of paromomycin along with the neomycin. We can use it is for the hepatic एक neomycin use कर सकते हैं, एक paromomycin use करते हैं, and the third one is a lactulose. Paromomycin, it is also effective against the Entamoeba histolytica, Giardia, Leishmania. ठीक है, इसके अगेंस्ट. सो वी कैन यूज दिस पैरामोमाइसिन कहाँ पे? हेपेटिक एनसेफेलोपैथी एंड फॉर द विसरल लिशमेनियासिस, वहाँ पे भी यूज करते हैं. देन ड्रग फॉर द हेपेटिक कोमा एंड encephalopathy or their mechanism of action. Then mechanism of action of aminoglycoside. Misreading. They freeze the initiation and they cause the misreading of the messenger RNA codon. Then significance of the spelling of mycin and mycin. This Y and I, this is a Viva-Voce question. And aminoglycoside which are effective against the tuberculosis. So remember this one as a SAT. SAT is streptomycin. Yeah, इस वाले chapter में SAT में streptomycin. Then we have A is not amikacin and tobramycin. ठीक है, canamycin is उसका alternative. और CAT. C is a capreomycin. So this is not a spelling इसके aminoglycoside से है जैसे हैं, but it is not an aminoglycoside. It is a peptide antimicrobial agent. Same, it is mechanism of action, side effect, everything is like a aminoglycoside, but we do not classify it under aminoglycoside. So इसको tuberculosis को हम SAT या फिर CAT कैसे भी इसको याद कर लो ऐसे, right? So that's all about the aminoglycoside. If you like my video, please subscribe my channel and put up your important suggestion in the comment box.